Kim Kelly. I'm the South Carolina State Director for the Humane Society of the United States. First, I just want to briefly say that there are a few provisions of the bill that HSUS does agree with. The medical record keeping for animals and the shelter's care, maintaining and providing records detailing the number of animals brought into shelters and the disposition of those animals, how they end up leaving the shelters. I believe that's already in practice in many shelters across the state, but really it should be done in every shelter. And it's also advisable that prescription medications are accurately labeled, so we completely agree with all of those. However, despite those provisions, we're seriously concerned about the geographical restrictions on mobile clinics as well as a limitation on services based on financial status. Veterinary visits have been on the decline for more than a decade, even as pet ownership has been on the rise. It's troubling and it is a legitimate concern for the South Carolina veterinary community. But studies commissioned by the veterinary profession themselves have demonstrated that nonprofit clinics do not play a substantive, much less a significant role in that decline. Excuse me. The 2011 Bayer Veterinary Care Usage Study, commissioned by Bayer Healthcare, which I'll be happy to provide for you, identified 6 primary factors causing the decline in visits to private practice veterinary clinics. Number 1 being the economic impact of the recession. As unemployment rates increased, it's not surprising that the spending on veterinary care decreased. Even during that time, however, veterinary rates continued to climb, in many instances above the rate of inflation. 2, the significant increase in veterinarians, which Joe alluded to. Between 1996 and 2006, over a 10-year period, the number of practicing veterinarians increased by 46%, which far outpaced the growth in dog and cat ownership. 3, increased internet research, substituting for office visits. With the advent of the internet, pet owners are more and more relying on the internet for veterinary research. In the study, 39% of pet owners said they'd look online first before going to a veterinarian, and 15% agreed with the statement that they rely less on a veterinarian after doing the research. Cost of care, 53% of those in the study cited sticker shock as an obstacle to obtaining veterinary care. 5, feline resistance. The majority of cat owners simply don't take their cats to a veterinarian. And finally, the perception that regular checkups are unnecessary. Nearly half of the respondents believe that regular checkups are necessary or were neutral on the question. So one of the points of the study is, again, that nonprofit organizations are not one of the major deterrents and are not luring away pet owners from their practices. Mr. Elmore provided some really great testimony, and he kind of stole my thunder with a lot of the points I was going to make. He has a way of doing that. But I did just want to briefly touch on the 7-mile restriction, which I understand is an arbitrary distance at this time. But
it's truly arbitrary, and we expect that to change.
Sure. But I wanted to briefly speak about...
And I will give Senator McElveen credit. At least he put it into the realm of what we were discussing and come up with something that's reasonable. But listen, this young man over here is a good friend of mine and the Senator from Sumter, and he's doing what he thinks is best for animals.
Of course. I wanted to expand a little bit about the Pets for Life program that Mr. Elmore mentioned. Pets for Life is a program by the Humane Society of the United States where we physically go into underserved neighborhoods. These are the poorest neighborhoods in our states, and we provide humane education, veterinary services, and we essentially try to help them become better pet owners. And not only does it provide critical services for them, but it also keeps the numbers of animals, or it reduces the number of animals going to shelters from those communities. In South Carolina, we have one Pets for Life community. It's in Charleston, and it's administered by Charleston Animal Society. Actually, Mr. Roman is charged with overseeing that program. And with a 7-mile restriction, pardon me, even a much lower restriction, in Charleston, we have an extraordinary number of veterinarians. I think even if it were a mile restriction, it would be difficult for our mobile clinics to go in there and provide those services. And as Joe said, that would essentially shut down the Pets for Life program, which is critical because over the past 15 years or so, we've recognized that it's those poorest communities where the animal welfare movement really needs to be getting in there, building relationships with the community and demonstrating that there is a better way to care for these animals. In those communities, about 90% of the animals are still intact. They have not been spayed or neutered. Consider the national average of pet ownership where it's less than 20% of animals are still intact. So it's really, really critical that we get in there. Also, we're concerned about the restrictions on services provided to privately owned animals whose owners don't fall below the federal poverty guidelines. Means testing fails as a method of identifying those capable of paying for-profit veterinary care. South Carolina's statewide median household income is under $45,000. So a significant number of South Carolina pet owners are simply going to be unable to afford even basic veterinary care. To discount them from the population of citizens needing access to low-cost or free services is simply punitive to those families and their animals. This bill won't generate a larger clientele for private practice veterinarians, but it will ensure that pets from the struggling middle class will not receive the necessary veterinary care.
Thank you so much. And would you provide that study? You quoted some details on the distances and the I guess the survey you did.
Absolutely.
If you provide that, we would appreciate it very much. Any questions? Thank you.
Thank you.